Good day everyone, welcome to Pharmacist channel. Please remember that this video is intended to provide a quick guide on the use of products for external use in the skin, nails, or hair presented by a community pharmacist. And this video is not intended to cover a piece of comprehensive information on the subject being presented here. It is necessary to read the label and the leaflet of the product and the product container in relation to the manufacturer's recommended use. This is important because the product sources and how the product is packaged and made may influence a variety of differences in each unique product. Also, it is important to remember that skincare products are not as strictly regulated as compared to the production of drugs. So please follow the instructions provided by the manufacturer. Do not use more than the recommended amount. Do not experiment on yourself. Some side effects are irreversible, such as the darkening of the skin when hyperpigmentation occurs as a result of misuse, abuse, or injury caused by the product. Cosmetic products or skincare products are not medicine and do not use them as such. It is not a replacement for your current medication. Before I start the video presentation, I would appreciate it very much if you can subscribe, like, and share to support my channel. Without further ado, let's begin the video training. The skincare ingredients on review for today is hyaluronic acid. Low molecular weight hyaluronic acid has the ability to penetrate the skin. High molecular weight hyaluronic acid does not penetrate the skin. The other name for hyaluronic acid is hyaluronin. Hyaluronic acid or hyaluronin is an anionic, non-sulfulated glycosaminoglycan distributed widely throughout connective, epithelial, and neural tissues. The dosage forms on review are the following: topical, lotion, cream, and serum. The percentage range of hyaluronic acid that we will be focusing on is below 2% and 0.1%. Here is the noteworthy information that you may need to know about this active ingredient. Here are the biological properties of hyaluronic acid. It is naturally found in many areas of the human body. Examples are the skin, eyes, umbilical cord, synovial fluid of the joints, and also in all tissues and fluids of the body such as the skeletal tissues, heart valves, the lung, the aorta, the prostate, etc. As we age, the production of key substances in the skin such as hyaluronic acid, collagen, and elastin decreases, and as a result, our skin loses volume, hydration, and plumpness. Premature aging of the skin is the result of repeated exposure to UV radiation. Approximately 80% of facial skin aging is attributed to UV exposure or photoaging. The primary source of the artificial production of hyaluronic acid is primarily made by bacteria in a lab via a process called biofermentation. Here are the physical properties of hyaluronic acid. Hyaluronic acid is a humectant. A humectant is a substance that retains moisture. It is capable of binding over 1,000 times its weight in water. 1 gram hyaluronic acid holds 6 liters of water. It is important to note that not all hyaluronic acids are created equal. The key to its function is its ability to penetrate the skin or its bioavailability. Higher molecular weight hyaluronic acid can absorb more water but will only sit on top of the layer of the skin. However, the small molecular weight hyaluronic acid, although will hold less water, may penetrate the skin to exert more surface hydration. In relation to the molecular weight size and diameter of hyaluronic acid, the conventional hyaluronic acid is 3,000 nanometers in diameter, and the intracellular space or the space between cells is only about 15 to 50 nanometers and 6 to 10 nanometers at the hyaline membrane. This is the reason why ordinary hyaluronic acid can't penetrate the skin. Ordinary hyaluronic acid will only sit at the top of the skin and will serve as a protective layer. The weight of hyaluronic acid does matter, and the bioavailability or the ability to penetrate the site of action of hyaluronic acid depends on its molecular weight or the molecular size of the molecules. Here are some of the interesting results of using a different molecular weight size of hyaluronic acid. For 1,000 to 14 kilodaltons or hyaluronic acid with high molecular weight does not penetrate the stratum corneum. For larger molecules, with a molecular weight greater than 500 kilodaltons, has a more difficult time passing through the skin barrier. For 50 to 1,000 kilodaltons, this is the most beneficial molecular weight of hyaluronic acid to the skin. This molecular weight has an improvement in wrinkle depth and skin roughness after 60 days of application. For 130 kilodaltons is the best molecular weight size tested between the range of 50 to 1,000 kilodaltons tested. The 130 kilodaltons increased skin elasticity by 20%, and the duration of treatment was 30 days based on the laboratory experiment used. Another result is between 30 to 300 kilodaltons, which is also absorbed through the stratum corneum, and below 50 kilodaltons might cause inflammation. There are 2 noteworthy experiments that I would like to discuss based on the result of the experiment used. The first experiment was composed of using different molecular weights of hyaluronic acid on a limited number of female subjects. The result of the experiment showed that there was an improvement in the 50 and 130 kilodaltons of the hyaluronic acid group after 60 days of treatment compared to the placebo-treated area. Placebo means a product with no active ingredients. This experiment showed that the topical application of all 0.1% hyaluronic acid formulations used in this study led to significant improvement in skin hydration and elasticity. The application of low molecular weight hyaluronic acid was associated with a significant reduction of wrinkle depth, which may be due to the better penetration abilities of low molecular weight hyaluronic acid. The second experiment used a smaller substance of hyaluronic acid with a diameter under 50 kilodaltons in a small number of female patients also. The aim of this study was to evaluate the efficacy of a new topical low molecular nanohyaluronic acid preparation in treating wrinkles, skin hydration, and skin elasticity in humans. The result of the study showed a statistically significant moisturizing effect of the product range such as lotion, serum, and cream after 2, 4, and 8 weeks of treatment. Measurement of skin roughness showed a significantly finer skin structure after 2 weeks of treatment, and skin elasticity showed a significant improvement after 2 to 8 weeks of treatment. In the conclusion of this experiment, the new nanohyaluronic acid clearly demonstrated a significant benefit in decreasing the depth of wrinkles, and skin hydration and also skin firmness and elasticity were significantly enhanced at the end of 8 weeks. The cosmetic company's recommended usage or indication. Remember that topical products will not be greater in the effect compared to the fillers or injectable forms. Topical products are being falsely marketed as topical fillers. Topical products are not topical fillers. Topical products are excellent moisturizer on the skin surface only. The cosmetic and other uses are the following. It prevents and reduces the appearance of wrinkles on the face. It is indicated in ophthalmological preparations or oral capsules to treat discomfort caused by dry eyes or conjunctivitis and for its protective qualities during and before eye surgery. Its off-label use is to coat the bladder for relief of interstitial cystitis symptoms. The non-surgical cosmetic procedure used. The dermal fillers are used to correct facial imperfections or other imperfections. This is used to improve volume loss. Examples of correcting the facial volume losses: lifting of cheeks, softening deeper folds and creases around the mouth and chin, improving the look of sunken, dark, under eye circles, hydration and enhancing the lips, and rejuvenating the hands and earlobes, augmenting some of the parts of the nose, chin, and jawline, like nose lifting, jaw contouring, and chin augmentation. It is important to note that topical hyaluronic acid can't correct the volume loss. This is the major difference between a topical and an injectable form of hyaluronic acid. Here are the laboratory results of the hyaluronic application. For adult skin application, for the management of the following conditions: decreasing the depth of wrinkles, skin hydration, skin firmness, skin elasticity. Apply to skin with 0.1% hyaluronic acid of lower molecular weight applied as a lotion, serum, and cream twice daily for 30 to 60 days. On another study, application of lotion, serum, and cream containing the new nanohyaluronic acid or hyaluronic acid less than 50 kilodaltons in diameter for 2 to 8 weeks resulted in a significant benefit in decreasing the depth of wrinkles, and also the skin hydration and skin firmness and elasticity of the skin were significantly enhanced at the end of 8 weeks. How to apply on the skin. Make sure that your face and fingers are clean. Applying this ingredient or a product that contains this ingredient on dirty skin may cause the impurities or other small substances to penetrate the skin, thus causing more problems than solutions. Do not apply on the skin more than the recommended amount by the manufacturer. Do not apply on the skin. Before the application on your skin, do a skin test first. Observe if you will be experiencing redness or itchiness after several hours. If you experienced a negative reaction, it is advisable not to continue with the product. You may be experiencing an allergic reaction to the active ingredients or any of the components of the product. Do not apply also if you have the following skin condition: skin breakout or pimple breakout, open wounds, and similar skin problem. Please also remember that fillers are given by trained healthcare professionals or estheticians. Do not attempt to inject it into your skin or ask someone to inject it for you. The common side effects of these active ingredients are the following. It is generally well tolerated, rarely cause allergic reactions or irritate sensitive skin, safe to use on the skin during pregnancy and while breastfeeding. Always inform your doctor or healthcare professional if you are applying this cosmetic product if you are pregnant or breastfeeding. Hyaluronic acid with low molecular weight may have the potential to cause inflammation. It can cause blindness. This is a rare side effect. How to store this product. Follow the manufacturer's storage procedure. Store it in a cool, dry place and not in direct sunlight. Store it at temperatures not exceeding 30 degrees centigrade. And remember to keep this product away from children. Other recommendations when applying this active ingredient. Do not use it as a drug or a drug replacement. Do not use more than the recommended amount. Intrinsic or innate or natural aging is a natural process and is inevitable. Try to eat healthy with a balanced diet as much as you can. Hydration is also important when you are on this product. And exercise. There are 2 types of aging: intrinsic aging and extrinsic aging. Extrinsic aging is the result of exposure to external factors, mainly ultraviolet irradiation or commonly known as photoaging. Extrinsic aging may be minimized or prevented using sunblock, umbrellas, or timing the sun exposure to a minimum. Other sources of aging may be the result of hormonal changes in the body. Deficiency in estrogens and androgens also results in collagen degradation, dryness, loss of elasticity, epidermal atrophy, and wrinkling of the skin. Health and safety tips. Remember that hyaluronic acid is for topical use only. Do not use the topical product as the source of your injectable filler. Internal hydration is necessary to assist in moisturizing the internal part of the skin. Proper hydration is important. Hydration with electrolytes is necessary, especially during the hot seasons. It is a good idea to have frequent visits to your skin doctor or dermatologist or healthcare professional to review the health of your skin. You only have one skin. Do not experiment on it. Injury from misuse of the product will cause physical, emotional, and psychological concerns in the future. Exercise. Use antioxidants. Try minimizing stress. Thank your parents if you are gifted with good genes, a well-nourished household, and a stress-free environment resulting in a good skin structure. You own them that much if you still look great at a very old age as compared to the majority of your peers and friends. Wear your sunblock properly when you expose your skin to UV rays. Follow the direction of the sunblock product for maximal protection from the sun. Photo damage causes 80% of sun damage, aging, or photoaging. Additional use of an umbrella or walking on the shades can also assist in lessening direct UV exposure. Dermal fillers are given by trained board-certified professionals only. Ensure that the hyaluronic acid comes from a reliable source or reliable manufacturer. This is to ensure that the hyaluronic acid is sterile to prevent the unwanted introduction of bacteria during its production and packaging. Thank you. That ends our hyaluronic acid discussion. Once again, remember that this is a cosmetic product for external use and not a medicine. Do not replace your medication with it. If you need more information about this cosmetic product, please visit your nearest pharmacy and talk to your pharmacist. And before I end this video, kindly check my YouTube channel, Pharmacist, for other videos. If you want to see my new video upload every week, please hit the notification bell and subscribe. See you again in my next video. Thank you.